If you have a hypothyroid condition and you've never had this lab marker checked, you're going to want to get this done ASAP. Allow me to explain. Let me show you this picture. So this is a lab from one of my patients, and what we're actually checking here is what they call antibodies against your thyroid. So what that simply means is you have an autoimmune disease against your thyroid. The current research shows that 90% of people that actually have a hypothyroid condition have an autoimmune disease, which is called Hashimoto's disease. And this lab test right here, this is how we determine if you have just a simple hypothyroid condition or you have a more complex autoimmune condition called Hashimoto's disease when it comes to your thyroid. So let me show you right here. The first lab right here, you're going to see thyroid peroxidase. Now you see her number here is 225. We want that to be less than 34. Then there's a second marker here that we also check at the same time, which is called thyroglobulin antibody. And you can see here, hers is 6, and we want this to be less than 0.9. So what does this indicate? This indicates that this client has an autoimmune disease against her thyroid. Now, if you have one autoimmune disease, you probably have 3 or 4 or 5 other autoimmune diseases that have never been diagnosed. This is why people go in the conventional system, they get put on thyroid medication and they don't feel better. Why? Because no one's addressing the underlying autoimmune disease. In the conventional system, they don't check this marker. Why? Because their treatment remains the same, whether you have an autoimmune disease against your thyroid or not. Now, my approach is we're actually going to handle and address your autoimmune disease so you can get to the root cause of your problem and feel better. If you've enjoyed this content, please like, comment, and share this with a loved one.